Rituximab is a commonly used biological treatment for rheumatoid arthritis, RA, that has shown significant effectiveness in managing symptoms and improving patient outcomes. This medication targets a specific protein on the surface of B cells, which are responsible for producing antibodies that contribute to inflammation and joint damage in RA. When administered, rituximab works by depleting B cells from the bloodstream, reducing the production of inflammatory antibodies and subsequently decreasing inflammation in the joints. This mechanism of action sets it apart from other treatments, such as traditional disease-modifying antirheumatic drugs, DMARDs, and nonsteroidal anti-inflammatory drugs, NSAIDs, which primarily focus on suppressing the immune response or alleviating symptoms. Clinical trials have provided evidence of rituximab's efficacy in treating RA. One study published in the New England Journal of Medicine found that rituximab, when combined with methotrexate, resulted in significant improvement in disease activity compared to methotrexate alone. Another study, published in Arthritis and Rheumatology, demonstrated that rituximab was effective in reducing the signs and symptoms of RA in patients who had previously failed to respond to other DMARDs. In terms of safety, rituximab has a well-established profile. Common side effects include infusion reactions, such as fever, chills, and nausea, which can usually be managed by adjusting the infusion rate or administering premedication. Serious adverse events, such as infections and malignancies, are rare but can occur. It is important for patients receiving rituximab to be closely monitored by their healthcare providers to ensure early detection and appropriate management of any potential complications. Rituximab has proven to be a valuable treatment option for many patients with RA, particularly those who have not responded well to conventional therapies. However, it is essential to consider alternative options and compare their efficacy and safety profiles before making a decision. Now, let's explore abatacept as another biological treatment for rheumatoid arthritis. Examining the effectiveness and safety profile of abatacept. Abatacept is a biological medication used in the treatment of rheumatoid arthritis that targets T cells, another crucial component of the immune system involved in the development and progression of RA. By inhibiting the activation of T cells, abatacept helps to regulate the immune response and reduce the inflammation that leads to joint damage. Numerous clinical trials have demonstrated the efficacy of abatacept in improving both the signs and symptoms of RA and the physical function of affected individuals. For example, a study published in The Lancet showed that abatacept, when combined with methotrexate, significantly improved disease activity compared to methotrexate alone. Another trial published in Arthritis and Rheumatology found that abatacept was effective in reducing radiographic progression in patients with early RA. In terms of safety, abatacept has a generally favorable profile. Common side effects include headache, upper respiratory tract infections, and injection site reactions. Serious adverse events, such as infections and hypersensitivity reactions, are possible but uncommon. As with any medication, careful monitoring is necessary to ensure early detection and appropriate management of any potential complications. The choice between rituximab and abatacept ultimately depends on individual patient characteristics and treatment goals. While both medications have demonstrated efficacy in managing RA symptoms, they have different mechanisms of action and may be more suitable for specific patient populations. Let's now compare the efficacy and safety of abatacept with rituximab to further help you make an informed decision. Comparing the efficacy and safety of abatacept with rituximab. When comparing the efficacy of abatacept and rituximab, it is essential to consider the available clinical trial data and real-world evidence. Direct head-to-head studies comparing the two medications are limited, making it challenging to draw definitive conclusions about their relative effectiveness. However, both drugs have demonstrated positive outcomes in the treatment of rheumatoid arthritis. Rituximab has been shown to be effective in patients who have failed to respond adequately to one or more previous DMARDs, including methotrexate. It has also proven effective in reducing disease activity and improving physical function in patients with early RA. This makes rituximab a suitable option for individuals who have not experienced satisfactory results with other treatments or who require a more targeted approach to their disease management. Abatacept, on the other hand, has been shown to be effective in a broader range of patients, including those with early RA and those who have not previously been treated with DMARDs. It has also demonstrated the ability to slow radiographic progression of joint damage, making it an attractive choice for individuals concerned about long-term joint health. In terms of safety, both medications have well-established profiles. Rituximab may carry a slightly higher risk of infusion reactions, including fever, chills, and nausea, compared to abatacept. However, serious adverse events, such as infections and malignancies, can occur with either medication, although they are relatively uncommon. It is important to note that individual patient characteristics and preferences should guide the choice between rituximab and abatacept. Factors such as the severity of RA, previous treatment outcomes, and the presence of comorbidities should be carefully considered. Now, let's delve deeper into the factors that should be taken into account when choosing between these two biological options. Factors to consider when choosing between rituximab and abatacept. Several factors should be considered when deciding between rituximab and abatacept as biological treatment options for rheumatoid arthritis. These considerations will help determine which medication is likely to be the most effective and suitable choice for each individual. Disease severity. The severity of RA can influence the choice of biological treatment. Rituximab may be more appropriate for patients with moderate to severe disease activity who have not responded adequately to other DMARDs. Abatacept, on the other hand, is approved for use in both early and established RA, making it a suitable option for a broader range of patients. Previous treatment outcomes. If a patient has failed to respond to previous DMARDs, including methotrexate, rituximab may be a viable option. However, if a patient is newly diagnosed or has not yet received DMARD therapy, abatacept may be a more suitable first-line option. Comorbidities. The presence of comorbidities, such as infections or malignancies, may influence the choice of biological treatment. Rituximab carries a slightly higher risk of serious infections compared to abatacept, which may be a consideration in patients with a history of recurrent infections. Patient preferences. Patient preferences and lifestyle factors should also be taken into account. For example, rituximab is typically administered intravenously, while abatacept can be self-administered subcutaneously. The route of administration may influence a patient's choice based on convenience and comfort. Cost and insurance coverage. Financial considerations, including the cost of the medication and insurance coverage, may impact the decision-making process. It is important to discuss these factors with healthcare providers and insurance representatives to ensure access to the most appropriate treatment option. It is crucial to consult with a rheumatologist or healthcare provider when considering rituximab or abatacept as biological treatment options for rheumatoid arthritis. They will consider the individual patient's unique circumstances, disease characteristics, and treatment goals to recommend the most suitable medication. Let's now explore some case studies and real-life experiences to provide further insights into the use of rituximab and abatacept. Case studies and real-life experiences with rituximab and abatacept. To gain a deeper understanding of the practical applications and outcomes of rituximab and abatacept in the management of rheumatoid arthritis, let's explore some case studies and real-life experiences. Case Study 1. Mary, a 52-year-old woman with long-standing RA, had failed to achieve disease control with conventional DMARDs such as methotrexate. Her rheumatologist recommended rituximab as a targeted approach to managing her persistent disease activity. After receiving rituximab infusions, Mary experienced a significant reduction in joint pain and swelling, allowing her to regain mobility and improve her quality of life. Case Study 2. John, a 38-year-old man recently diagnosed with early RA, expressed concerns about the long-term impact of the disease on his joints. His rheumatologist recommended abatacept due to its ability to slow radiographic progression. John began self-administering abatacept injections and noticed a gradual reduction in joint inflammation and increased functionality. He is now able to maintain an active lifestyle and has experienced minimal disease progression. Real-life experience. Sarah, a 45-year-old woman with moderate RA, initially tried several DMARDs with limited success. She decided to explore biological options and consult with her rheumatologist, who suggested rituximab. Sarah underwent several rituximab infusions and found that her disease activity significantly decreased, allowing her to engage in activities she had previously been unable to enjoy. She continues to receive rituximab infusions as part of her ongoing treatment plan. These case studies and real-life experiences highlight the positive impact that both rituximab and abatacept can have on patients with rheumatoid arthritis. While individual responses may vary, these medications have the potential to improve symptoms, enhance physical function, and enhance overall quality of life. However, it is crucial to be aware of the potential side effects and precautions associated with these medications. Potential side effects and precautions of rituximab and abatacept. As with any medication, Rituximab and Abatacept carry potential side effects and precautions that should be considered before initiating treatment. Rituximab. Infusion reactions. Rituximab infusions can sometimes trigger infusion reactions, including fever, chills, nausea, and allergic reactions. These reactions can usually be managed by adjusting the infusion rate or administering pre-medication. Infections. Serious infections, including pneumonia and sepsis, can occur with rituximab. Patients should be vigilant for signs of infection and promptly report any symptoms to their healthcare provider. Malignancies. Rare cases of malignancies, including lymphomas, have been reported in patients receiving rituximab. Regular monitoring and evaluation are essential to detect any potential malignancies early. Abatacept. Headache. Headache is a common side effect of abatacept and is usually mild and transient. Upper respiratory tract infections. Abatacept may increase the risk of upper respiratory tract infections, including the common cold. Patients should take appropriate precautions to minimize exposure to infectious agents. Injection site reactions. Localized reactions at the injection site, such as redness, swelling, or pain, may occur. These reactions are typically mild and resolve on their own. It is important to remember that the potential benefits of rituximab and abatacept generally outweigh the risks for most patients. However, close monitoring by healthcare providers is crucial to ensure early detection and appropriate management of any potential complications. Consulting with a rheumatologist will provide a comprehensive understanding of the potential side effects and precautions associated with these medications. Consultation with a rheumatologist and personalized treatment options. To determine the best biological option for rheumatoid arthritis, it is crucial to consult with a rheumatologist or healthcare provider. These specialists have the expertise and knowledge to assess individual patient characteristics, disease severity, treatment goals, and potential risks and benefits of rituximab and abatacept. Together, patients and healthcare providers can create personalized treatment plans that optimize outcomes and improve quality of life. During the consultation, patients should openly discuss their concerns, preferences, and expectations. The rheumatologist will ask questions about medical history, previous treatments, and current symptoms to gather essential information. They may also perform physical examinations, order laboratory tests, or request imaging studies to assess disease activity and joint damage. Based on this comprehensive evaluation, the rheumatologist will recommend the most appropriate biological treatment option, either rituximab or abatacept. The chosen medication will be based on factors such as disease severity, previous treatment outcomes, comorbidities, and patient preferences. The rheumatologist will also provide guidance on potential side effects, monitoring requirements, and precautions associated with the selected medication. It is important to maintain regular follow-up visits with the rheumatologist to monitor treatment response and address any concerns or side effects that may arise. Adjustments to the treatment plan may be necessary based on the individual patient's response and disease progression. Conclusion and final thoughts on the best biological option for rheumatoid arthritis. Rituximab and abatacept are both effective biological treatment options for rheumatoid arthritis that have shown significant efficacy in managing symptoms and improving patient outcomes. Rituximab targets B cells, reducing inflammation and slowing disease progression, while abatacept inhibits T cell activation to suppress the immune response responsible for joint damage. When choosing between rituximab and abatacept, it is important to consider factors such as disease severity, previous treatment outcomes, individual patient characteristics, and preferences. Consultation with a rheumatologist or healthcare provider is crucial to make an informed decision and develop a personalized treatment plan. While both rituximab and abatacept have well-established safety profiles, potential side effects and precautions should be considered. Regular monitoring and close communication with healthcare providers are essential to ensure early detection and appropriate management of any potential complications. Ultimately, the best biological option for rheumatoid arthritis will vary depending on individual patient circumstances. By working closely with a rheumatologist, patients can find the most suitable treatment option that provides optimal symptom relief, improves physical function, and enhances overall quality of life.